Hi all. ഇന്നത്തെ ക്ലാസ്സിൽ നമ്മൾ ഡിസ്കസ് ചെയ്യാൻ പോകുന്നത് ഒരു വാസ്കുലർ ഡിസോർഡറാണ്. സാധാരണയായി നിങ്ങൾ എക്സാമിന് പ്രിപ്പയർ ചെയ്യുമ്പോൾ കണ്ടുവരുന്ന ഒരു ക്വസ്റ്റ്യനാണ് റിലേറ്റഡ് ടു ഡീപ്പ് വെയിൻ thrombophlebitis. You can get several questions related to this condition. So what is deep vein thrombophlebitis? It's a disorder of the vein where thrombus or clot forms in the veins, especially in the deep veins of the legs. Then it will occlude the venous return and also inflammation of the vein occurs. So there are some predisposing factors for this condition. The most important predisposing factor being immobility. As the venous return needs to be increased, the muscle needs to be contracted. So in this condition, muscle cannot contract, means in immobility, muscles are not contracting and which are not pushing the venous blood to the heart. So pulling off the venous blood occurs in the deep veins, especially deep veins of the legs, and it is predisposing to clot formation. Then it occludes further venous return and it will also cause inflammation of the vein. Now we'll see what assessment findings we can see in this. Assessment findings inathu pradhanamaayittum varunathu tenderness with or pain with or without swelling in the calf region or in the groin region. And there is a very special sign associated with the DVT, that is positive Homan sign. So how we can know the patient is having positive Homan sign? We have to dorsiflex the feet. So on dorsiflexion of the feet, patient feels pain in the calf area. This is known as positive Homan sign. You might have seen that you have getting questions regarding this Homan sign or the assessment finding regarding DVT. So remember, this is very important assessment finding in DVT. And what complications can arise from this condition? So this is really a serious condition because it can predispose to the development of pulmonary embolism. So embolic complications, as the clot is moving from there, and especially it can, as I told you, the major complication of this condition being pulmonary embolism, and also other embolic complication can occur. Our intervention is related to prevention of this embolic complication. So what advice we have to give? The persons who are predisposed to develop this DVT, we have to mobilize them as early as possible, especially after post-operative period, other conditions. We have to tell the patient that they have to get ambulated as early as possible. And if the patient cannot be ambulated, we have to change the position of the patient in the bed. Also, leg exercises are also advised to the patient to prevent the pooling of blood in the veins of deep veins of the legs. But once a patient develops deep vein thrombophlebitis or DVT, we should not mobilize the patient. So we have to keep the patient on bed rest. So what is the rationale behind that one? Because we should not allow the clot to move from there and causing the complication. So give bed rest to the patient, and also we have to keep the leg in elevated position above the level of heart to increase the venous return, so that further pooling of the blood in the vein will be avoided. Then we have to lysis the clots which is formed. Thrombolytic treatment should be given to the patient to dilute or dissolve the clots which is already formed. Then we have to give anticoagulants to prevent further formation of the clots. So we are starting with the heparin as an anticoagulant first, and the patient who is taking heparin, we know that we have to monitor the APTT value. And we have to monitor for hemorrhage or bleeding because we are giving anticoagulant. And after the heparin therapy, oral anticoagulation therapy also will be given. So we are giving this warfarin sodium to the patient, And while if the patient is taking this warfarin sodium, we have to monitor PT and INR value. And if overdose or bleeding develops due to heparin, we have to give protamine sulfate as the antidote. And for warfarin, the antidote is vitamin K.